guidelines not included in the Public Health Act that led to this limousine driver being able to transport?
Well, clearly, every person involved in the system is well aware. In fact, through all the fact sheets and information provided, we're getting to the bottom of that. We're waiting for police to conduct all of their investigations, and then if we need to do more, we will. But let me make it clear. It is in black and white what people's responsibilities and obligations are. Okay, but that's why we'll await the police investigation. And as I understand, discussions are already underway with the Health Minister and Police and Health in order to do more if we have to. But let's not take away from the fact that all of us know what we're told as the advice we need to take, and people need to follow that. It doesn't matter where it's written. Of course, the health orders mean police can fine and cause people to have that penalty. But all of us know our obligations, and in a pandemic, complacency has no place, And it's so important to make sure that everybody undertakes their responsibilities at every stage, and that's why I'm appealing to every single citizen. It doesn't matter whether you have a position like I do or you have any circumstances. All of us must conform to the health advice to the letter of the law, and must continue to watch the health advice in case that advice changes.
Can I just quickly ask on vaccinations?
Yeah.
I think, at the West Hoxton party, there was 4 or 5 people who were vaccinated, and they haven't got the virus so far. What does that tell you about a super spreading event, yet the vaccinated people didn't get the virus?
I'd like Dr. Chan, as a medical expert, to answer that one.
Okay, a couple of things. It's pleasing news, and we're actually going to be looking at that quite closely. And yes, there were a number of people there that were either aged care workers or healthcare workers who were vaccinated, and that is very pleasing to me, because obviously we need to protect those workers. They are at greatest risk and also are working with the most vulnerable of individuals. Vaccines are not perfect, so I think it's really important that we always look at the hierarchy of controls in our borders. We need to vaccinate them. We need people to adhere to PPE requirements. We need to keep our social distancing, and we need to do all of those environmental things that reduce the risk of transmission. Vaccines are effective in preventing serious disease, and we know they also have a transmission impact. We know that the Delta strain, although the vaccines have slightly lower performance than against other strains, and that's something that we have to be cognizant of. But the key message is, yes, vaccination is fantastic. We need to do it. It protects us against severe disease and hospitalisation, and it also has a transmission reduction, but we will still need to have those other measures. So the last thing we want is for people that are vaccinated to think that they don't have to quarantine if they're close contacts, that they don't have to wear masks. They are still at risk. We need those multiple layers of controls if we are to keep us safe in future incursions.